And then when we come back this afternoon around 12:30, we will actually practice putting a patient through our system. So we'll, as a group, we'll go in and we'll receive our patient, we'll complete the whole documentation on that patient, and then we'll discharge that patient as a group together. We're hoping, we've been able to anyway in the past couple training sessions, get through 2 of those as a group. And then we still have about an hour generally at the end where you can start working on your competency packet that we'll hand out, and then we'll be here to help you answer questions in that. Okay? In your packet, you'll see the first page is an index. Use this index to your advantage. Patsy did a good job of kind of labeling and directing you to certain areas within the training manual if you have questions as you're completing your competencies or when you're on the floor doing your parallel runs if you have questions. That first page is your index page. To launch into your tracker, you're going to go to, some of you will probably be called ED tracker, some may be labeled ER tracker, mine is labeled EDM tracker. But to get to your tracker, you're going to go through that pathway. We're going to start off by just discussing the tracker itself and some of its functionality in Meditech. You can see the ED tracker looks a lot like our PCS tracker that we have on the nursing floor. We were able to kind of develop it though and put the things in our tracker that we felt would be important for us to visualize in the emergency room. So there's a few things that are a little bit different. The first column in the left is same as PCS. This is where you open your chart. The next column is going to list the patients that are present in the emergency room. We have set up our ED tracker to display all patients, so you will not have to go and find a patient and add to your list in order to view them in the emergency room. Every patient that's in our ER will display on our tracker automatically.
Who puts them in? Additions?
You will.
Oh, okay.
We will receive them, and that's how they will flow onto our tracker. You'll see that first column, you can view the location of your patient, your name of your patient, and the age. In a lot of these fields, you can actually launch right into those screens from the tracker and input that data. So if a patient didn't have a room assignment, we could launch right into that from the tracker and assign them to a room if we wanted to. The little yellow flags is the same name flag. That's the same flag that we see on the PCS side. So if a patient has a similar or same name, that yellow flag is going to display on our tracker. The registration status, there's mainly 2 registrations we're going to see in our emergency room. It's a pre-ER and a reg-ER. The reg-ER signifies that a patient has been fully registered, and we'll go through that process later today as we work through our patients. But we have the opportunity to actually get our patients onto our desktop in a pre-ER status, which means pre-registered. There's very minimal data that we have to put in on our patients in order for them to display on our desktop. And then once we get them to display on our desktop, we can start documentation on them. So that's where you can go to quick see what status the patient is in, whether they're fully registered or they're in a pre-registered state. The next column is our complaint column. The emergency room ED model build was primarily built based on chief complaints. The premise of our ED model is you build your chief complaints and then you basically attach everything you need to document on that patient based on their chief complaint. So when we built the ED model, we tried to determine what we felt were our most common chief complaints. And then from that we attach documentation to that chief complaint. So you'll see as we talk and play today, it's important that you become familiar with the chief complaints that we've built. We've also associated aliases with the chief complaint, and so that while you're still learning the system, you probably won't know what all of our chief complaints are actually called. But if you search for an alias, like say the patient presents with a sore throat, what's going to pop up is our upper respiratory infection chief complaint. So the system is going to try to navigate you to the correct chief complaint based on the symptom you're inputting. And we will talk about the chief complaints a little bit more here in a minute, but from the tracker, you can click in the complaint cell and input their actual chief complaint from the tracker itself. In the next column, provider nurse, simply put, this is where you're going to be able to view who the attending provider is and who the nurse is that's caring for that patient. Again, you can click into the cell of the tracker and input that data if it hasn't been put in. The INT column, that's our intervention column. That's the same as PCS. That's going to display the items on our work list that we need to document on. You can launch right into your work list from the tracker by clicking on the Go to Work List tab in the INT column. The lab column is going to display lab orders that we have inputted on our patient. Again, you can launch right into those orders from the status board. The next column, the little check marks, we've color-coded 3 check marks so that we could easily visualize the process of our lab orders. We have a green code, a yellow code, and a red code. Red check marks signify that a lab order has basically not had anything done with it. We've inputted the order and lab has not collected it yet or processed it. If we see a yellow check mark displayed there, as you see it on the screen, it means lab has collected the specimen and they are processing the order. And if you see a green check mark displayed on your screen, that signifies that you have lab orders resulted out. You can launch into your lab column and view those orders. The radiology column shows us the RAD orders that have been inputted. Again, you can launch into your orders or your work list from the RAD column. Most of our radiology orders are not resulted out. We didn't put any type of a color scheme or check mark system to our RAD orders because generally they're put in and then they're in a pending state for the duration of our ER patient. And then the status and length of stay column at the end. The status tells us, is that column?
Yeah.
The status tells us whether the patient is in a registered status or a received status. We have a number of different status options that we could input into our tracker. However, I don't see us utilizing this feature a whole lot because we're such a small emergency room and we do one-on-one care with our patients. We're going to know if our patients are in radiology, if they're in the room or not. I could see this being probably more beneficial for a bigger facility that has multiple patients, where it would be helpful to look on the status board and see right away where that patient is. I think the statuses we'll see most often displayed on our status board, and the ED is received and registered. And again, that goes back to the process of where they're at in their admission process into the emergency room. And then the LOS is their length of stay. That counts down from the time they're admitted. Their length of stay will be highlighted in red if they've been here greater than 2 hours. It will be yellow if they've been here greater than 1 hour. And it will be green if they've been here less than 1 hour. So just a visual to remind you, our ultimate goal is to try to get our patients out within 2 hours, especially emergency rooms. So if their time's ticking down and it's past 2 hours, that's going to call your attention to that time and highlight that in red. You can also highlight your patient in green, and what will display down in the box down below is similar to PCS. We can predefine what information we want to display on our patients. Again, where we do one-on-one care, probably not quite as important as it is in PCS. But I could see some of this information being helpful at transition of care. So if one nurse is leaving and a new nurse is coming on, you could quickly glance at that and see what the oxygen flow rate is, what their IV detail is, that information. Any questions on just the tracker itself? Did I hit everything? Okay. We're to page 4 in your handout. We're gonna go through these body buttons on the right-hand side of our tracker. The list button is identical to the list button you see in PCS. You launch into the list and it gives you a few different options of locating patients. To access the emergency room, you're gonna go into the ED tracker list, and that's what we were checking to see if everybody had that option. The tracker button is simply that, it's going to display your tracker under the list. The on-call button, this button at this time we will not be utilizing. This is where if we wanted to input electronically the staff that is on call, we would do that here. However, it does need to be updated on a daily basis. So we have opted to keep with our monthly call schedule rather than somebody going in and inputting that data every day. So this time we will not be using the on-call staff option. The assignments tab works the same in ED as we've learned in PCS. However, again, every patient's going to display in the ED, so there's really no need to go in and assign anybody to you from the emergency room module. They're already going to be displayed on your tracker. Okay. The clinical data tab, again, as we learned in PCS, this is mainly a view-only tab. When you launch into that screen, there's a lot of information that's captured in this tab. However, we do not want you inputting information into this tab. We want this to be an option for you to go to view information only. If you remember from PCS, really the only info that we're going to input into this tab are those dietary instructions. If there's any communication to dietary, not in order, but communication we wanted to send to dietary, we would do that in the clinical data tab. In ED, our process with dietary is going to be the same. If a patient needs a tray, we're probably going to call the kitchen and request a tray. It's not something that we do very often. We could still send a diet order, but we're going to still want to call, because typically they're not going to be looking for those ER diet orders to come across. Okay. Does everybody remember where it is we actually would input that data from PCS training? The summary tab, and we'll get to the summary tab a little bit later. The summary tab is where we're going to go to input some of that data. The reassign ED staff, this tab we will not be using in the emergency room. You will see there's quite a few tabs that are defaulted onto our body buttons. A lot of these tabs are designed for large facilities with large emergency rooms, 10 plus beds with multiple staff. So the good thing is it may look overwhelming, but we don't use a lot of those tabs. So the manage orders button works similar to PCS side. This is where if we had orders inputted on a patient, you wanted to launch into those orders, acknowledge and confirm them, you would do that through the Manage Orders tabs. However, in the emergency room, we don't do chart checks or do like the oversight of the orders. We receive the orders, we put the orders in. So again, another tab I don't really foresee us utilizing much in the emergency department. The Patient's Reports tab. You will find in the ED, much like the PCS, there's probably about 4 different ways to get to pretty much anything you want to do in our module. This is one way where you can access a patient report. However, it is certainly not the easiest way. We're going to show you a much easier way to access a report. But if you were not in a patient chart and you wanted to access a patient report, you would go to the Patient Reports tab. You would select your patient and then click on Report at the bottom. And then you have to go to the drop down and select the report that you want to print. We have the main report that we will be utilizing in the emergency room is probably the ED transfer report. And that has a tab in itself that's much quicker to run that report than through the Patient Reports tab. So we'll show you that. But if you're not in a patient's chart and you want to access a report, you would go to the Patient Reports tab from the tracker. The consents form, same deal. Consents we can get to a number of different ways. If you're not in a patient chart and you want to access a consent form, you could access it from this tab. The consent forms are kind of a work in progress. More than likely, we will not have all of our consent forms built before go live. Main reason being, we will still be using paper for consent forms. We will not be doing electronic signatures, so we will still have a handwritten or a paper copy of the consent form that the patient has to sign. What's nice about the consent forms that we do build in Meditech, they print with a nice header on them. All the patient demographic information is captured on the form before you print it. However, you cannot document on the form electronically. You still have to print the hard copy and then fill out the form by hand. Was it messing up again?
Yep, messed up again, guys.
Messed up again.
Call Kelly.
I don't know what she did last time, but. So with the consent forms, we will continue to have our electronic folder that we currently use that houses all of our consent forms. So you'll still go to that folder if you need a particular consent form that has not been built in Meditech. The way I understand with the paper copies that we will have, they will be barcoded. So there'll be probably like a stickered barcode that we will attach to the form. And then that's how HIM will attach that form back to the patient chart. It will be actually barcoded. We haven't been fully shown that process yet, but we understand there will still be some paper aspects to our charts. Hopefully not a whole lot, but there will be still some forms. Location reports. Location reports is not a tab that you will be accessing or have a need to access. The calls tab, at this time, bless you Mary, at this time we will not be using the calls tab. The design of the calls tab is for follow-up phone calls. So if we were to start making follow-up phone calls and would want to document that, we would access it through the calls tab. Our process for incoming calls or medical advice calls will be the same as it is now, where a patient calls in, we document the call on the call-in form, and then that would be scanned into the system. The next 4 tabs are our biggies. Those are the tabs we're going to use most often from the status board. The reception tab, this is the first place we're going to go when we receive a patient. So when a patient presents to our emergency room, the first thing we are going to do is receive them. You can receive the patient in 3 different fashions. They can either be a walk-in, which means they've presented to our emergency room seeking treatment. 95% of our patients will probably be walk-in, designated as walk-ins. We do, however, have the option of putting our patients on our tracker prior to their arrival. So if they're being brought in by EMS and it's a critical situation and we know we need to get things going before the patient arrives, you can enter them through the reception routine and designate them as an EMS arrival. The only data that's required to know for an EMS arrival is the patient's sex and an approximate age. If you put a sex and an age in, select Add Patient, it will actually allow you to put the patient into our tracker prior to their arrival. You will need to input the EMS company that's bringing them in, and then an approximate ETA. Once we save that, what's going to display on our tracker is that St. Paul is bringing in a 49-year-old female. So at that point you could go in and start any documentation possibly, or order sets that you would know you would need for that particular patient type that's coming in.
That'll just transfer over on the Omnicell, is that,
On the Omnicell,
like to pull things out?
no, I'm
Still
guessing it would
that
be the
in.
same process, yeah. You will see the status that displays on a patient that has not arrived yet is incoming. We did not indicate an arrival time, obviously because the patient isn't here yet. So once a patient does arrive, you do need to launch back into that patient through the triage tab. Here is where you could input in the patient's actual name once we determine what their name is when they arrive. And the system will actually allow you to copy over everything that you had inputted in that chart prior to the patient's arrival. So you input your name, you could search for your patient. If they're a patient already in existence, you can select that patient. If it is the patient that is here, you would say, yes, that is the patient I'm wanting. You could confirm the account move, and that's going to move all the information that we've inputted in that temporary status to the patient's real status once they get here.
It does take a minute,
It's moving information over, so yeah.
because now it wants to compare that patient to the one you just selected, so it does take just a second for it to run through all the data. I should put an A in there, I bet it would get faster.
There's quite a few Patsy tests in
Yeah.
our test pool.
Yeah, probably get that a little faster.
So you see there, our 49-year-old female has now become Patsy Test. She is still in an incoming status, so we do need to go into that triage tab and input an arrival. Oh, I wonder why there's a date and time there.
Oh, because I'm in the wrong patient.
I was gonna say.
Probably works better if you pick the right patient.
Once she puts a date and time in, the patient status, you will see will change from an incoming to a received.
Just say now, when you get here, and they're good to go. Now they've been received.
Back in that reception routine, the call-in feature, if we receive a call from a family member or even from a patient saying they're going to be coming in but haven't arrived, and then again, it's emergency situation where you want to get them going before they physically get here, you can use the call-in feature. With the call-in feature, you do need the patient's name. It will not allow you to put the patient on the tracker with just an age and a sex. You will need the patient's name in order to input them as a call-in patient type. Any questions on those three?
And I didn't hear what Sarah said, but when you want to know if you can, say it's a trauma and you don't know what it is and you just put in what you can, are you able to pull out of the Omnicell then,
You would do like you do now. You're
Okay.
gonna put in
add a patient?
female, trauma, whatever. And then once you determine who the patient really is, then you're gonna manually,
Put it back?
yeah.
Okay.
Well, actually, once you register them or receive them, they'll fall then onto your Omnicell under their patient name, and then you take supplies out under their real name. I mean, again, you know, we only want you to put them on in an incoming status in those situations where it's an emergency and you want access to that information prior to their arrival. So, you know, maybe 5% of the time. The preference is still gonna be you see them before you admit them, you know, kinda like we do now. But I understand there's some situations where it is nice to get going before the patient gets here. So that's a nice feature with our Meditech system to be able to do that. Okay. Page 8 and 9 goes over that reception routine. The screenshot on page 9 is displaying what your prompt is going to look like if it's a new patient. So if the patient isn't already in existence, it's going to ask you, do you want to copy all your entry fields to the MPI, which is the Master Patient Index? And you're going to select yes, and then that's going to transfer over your temporary incoming patient to your formal patient once you've determined their name. In the reception routine, there's different fields. We pull another one up again. I forgot to mention the verified data birth. There's multiple fields that you can input in the reception routine. You will find these same fields in the triage routine also. In order to process or fully process a patient that you receive as a walk-in, the verify date of birth box under the language must be checkmarked. That's a required field. So you are required to verify the patient's date of birth when receiving a patient as a walk-in. You can see the start items are the required items that must be completed, and pretty much everything defaults in except that verify date of birth box that needs to be checked. From this reception tab, you can go ahead and enter a chief complaint here. You will see in the triage tab, which we'll look at next, you can also input the chief complaint there. What I see for our workflow in the emergency room, mainly it's going to be our techs that are going to enter through this reception routine. Our ER techs will not be selecting our chief complaints. Nurses will be selecting the chief complaints. So if our tech is receiving a patient, they're going to start here at this reception routine, verify our patient's date of birth. They may input a stated complaint, which is basically what the patient is stating they're here for. It's a free text box. You can put anything in the stated complaint section you want to. The tech can assign the ED provider, so we all know generally who's on call for the day. She could go ahead and put in who the on-call provider is. She could also indicate who the ED nurse is from the reception routine also. She may also assign a location. So the main ED is what's going to default in for our location, and then she could select room 1, 2, 3, or trauma room. We can put multiple patients in one room for purposes of the tracker. It will not inhibit you from putting only one patient in per room. Okay? Now I think I covered everything on the reception routine. Okay. The next tab under reception is triage. So like I said, once the patient is received by the tech, the nurse will launch into the triage tab. You will notice the triage tab has again a lot of the same information that we saw in the reception tab. In the triage tab is where the nurse can enter in that chief complaint. So you've received the patient, maybe you started collecting some information from the patient, and you're able to determine what it is they're here for, what is their chief complaint. If you click in the cell chief complaint, it will launch you right into the lookup of the chief complaints that are available to you to search from. You can enter more than one chief complaint. In the other complaints tab, again, had we not entered in the ED provider, ED nurse, we could do that from the triage tab. Again, you could input the room location of the patient from the triage tab. A lot of the same data fields are in both reception and triage. If a nurse is receiving a patient, you could launch right into this information right from the reception routine if it was a nurse that was receiving the patient also.
And if you put in another chief complaint here, you can delete them out of there. Oops, sorry. Here, to delete them out, you have to hit this X box to get rid of them. If you accidentally enter another in there you don't want. That little box looks different than everything else.
When you click in that chief complaint dictionary,
Here's how you delete that one out. If you made a mistake, okay? It just looks a little different there. But really, I want laceration.
and we've attached different aliases, like I said earlier, to particular chief complaints to try to direct you to the right chief complaint that's been built. On page 14 and 15, that displays all of the chief complaints that we have built.
Is there an other too, just in case there's?
There is not an other. You have to determine the chief complaint. So,
Don't know anything in there yet.
right. Part of our parallel runs and working through competencies, we're having you go in and test out different chief complaints. So as you're working through the system, if you're having a hard time fitting a particular diagnosis or chief complaint in somewhere, let us know. We can continue to build our list as we need to. Any questions on the whole chief complaint? In this triage tab, this is where we will document our patient's allergies and home meds. So the nurse is going to launch into the triage tab, and then you can go right into documenting allergies and home meds from there. You will see the screen looks just like it does in the summary tab of our patient chart. You can input new and edit existing exactly the same as in PCS. From this triage tab, you can also launch right into the documentation. In that triage assessment section down at the bottom, we have, that's okay. We have identified certain pieces of documentation that we have attached to every chief complaint. What we did was we looked at our workflow now, and then we built our documentation around the items that we document on now for every patient. So if you want to document on a patient right from the triage tab, you can select that intervention you want to document on, and then click document, and it will launch you right into that documentation from the triage tab. Our ED flow sheet that we built is essentially the information gathering section on the top part of our current ED flow sheet.
Kind of looks familiar.
Yeah, and when we go through and play on patients this afternoon, we'll have you actually go in and completely document on all these documentation sections too, so you can get a chance to see what's in them.
We were gonna tell them this, gives you the option to go.
Yes. When you select a chief complaint, we've also associated order sets with all of our chief complaints. So, it will give you the option, once you input a chief complaint, to go directly to the order associated with that chief complaint, or it will allow you to go back to the orders at a later time. 9 times out of 10, we're probably not gonna process the order the minute we put the chief complaint in. We're probably gonna go back to that after we've assessed the patient, gathered the data, notified the provider, and obtained the orders for that patient. But we will show you the orders tab also here in a little bit. Okay? Let's go ahead and, on page 18, we're going into the work list a little bit, so go ahead. We're on page 18 of your handout. Reviewing the work list, you'll see it looks similar to PCS. You will see there are a few items that are listed there in with a red asterisk. Those items were placed on our work list by our chief complaint. So behind the scenes, we attached particular assessments and interventions to each chief complaint. The other items that are not in red are the items that we are going to automatically default onto every patient that presents, regardless of what their chief complaint is. When we build these, we tried to build them to be all-inclusive, so that if something is not applicable to your patient, you can go in and delete it off of your status or off of your work list, rather than have to add it if you need it. We felt it would be easier to have it already there for you and have you just cancel it off if it's not applicable, as opposed to have to add it on if you need it. So you can click on that cell and cancel it if it's not applicable. So in this instance where we have a laceration, we have an IV fluid drip titration flow sheet attached to every chart. Most lacerations aren't going to have an IV. You can go in and cancel that off of your work list, and then it's no longer there and not required to chart on it. Yeah. Yeah. Or even though the red start items are attached to the chief complaint, again, an example of the laceration, say there's no need to apply direct pressure, their bleeding is controlled, same premise, you can cancel that off your work list if it's not applicable. We tried to put everything there for you so that it's available if you would need it. So keeping that in mind, we did build a scheduled ER chief complaint. Our emergency room's unique because we do those scheduled things in the emergency room. So some of these items are not required of scheduled ER patients. So same premise, Glasgow coma scale we don't obtain with a scheduled ER. That you could cancel off your work list. A pain assessment, if they're not here for a pain-related issue and it's not applicable, that could be canceled off your work list. So keep that in mind. Just because it's there, if it's not applicable, you don't have to document on it. We do still want you to document on, though, the things that we require now, like vitals, GCS, pain on discharge of all of our standard ER patients.
And then the other example would be a trauma. If a trauma comes in, you're gonna get your ED flow sheet, but you're also gonna get the trauma flow sheet. The ED flow sheet is duplicate information. Everything on the ED flow sheet is included on the trauma. Just get rid of your ED flow sheet.
We couldn't pick and choose. It was kind of an all or nothing
Yeah. situation,
so we opted to flow everything on and let you cancel it rather than have to add it if it's needed. Any questions on that? Okay, so we'll go back to our tracker and we'll finish up our body buttons over there. Let's see, under triage is ED transfer report. This report we have built to pull in all the possible data that you may need to capture in a report if you were transferring a patient out of the emergency room. So obviously remember your report is only going to be as good as your documentation. So if you haven't documented anything, your report's going to be blank. And I understand there are some situations where you will not have time to document if it's an emergency situation. In those cases, we're going to do as we do now, fax what we can, complete the report, and then fax the completed report once we've documented in it. But you can print an ED transfer report simply by clicking the ED transfer report tab. In that should capture everything: lab values, medications, vital signs, assessment documentation, really anything you should need to report off to a receiving facility.
And I would demonstrate it, but it's broke today.
Will allow you to display it.
Well, it's gonna, something broke on this.
We have Kelly come and fix our printer option. We'll show you what the report looks
Yeah,
like.
that was Jessica, she's gonna try and work on it, because
Okay.
Kelly told her to come, so
Okay.
we'll see if she can. She said we'll test it at break time and see.
Oh, perfect. Did we just need to call her? Because we'll probably be breaking here shortly, or?
Yeah, well, we're just supposed to see if it works. If it does, then we'll let her know. If it doesn't, we'll call her and she'll work on it some more.
So I can try it right now.
If you'd like, you can
Oh,
try.
okay.
She's
Thought
just gonna
maybe
work on it now,
okay.
so she might be able to fix it.
So if you print it, you wanna,
You're gonna print a hard copy of it to send with the patient to go to the receiving facility.
can you fill that in manually or not?
No, it's all, the report pulls everything
That you can
From-
here, it has
yeah.
to do with the system, it doesn't
from
have to do with.
behind the
that.
scenes.
So I'll call Jessica back, tell her to come over here, because she
Yeah.
come over here and she was gonna go back and work on it over there.
Yeah, because it's not a Meditech problem,
Yeah,
it's
it's
this
this-
screen board problem.
Okay.
It has nothing to do with Meditech.
What about a COBRA form? Will that be in the report, or will that be a form we have to fill out?
That will still be a freestanding form that you
Okay.
complete,
What's that?
the COBRA
COBRA,
form.
COBRA.
We have built that form in our consent forms, so that will print for you with the header on it. That's one form that we felt like we would use probably most often. It would be nice to have it.
You could click consent form here and choose this transfer form and then say print, and your COBRA form will spit out, but you, with your patient data top, but you still have to fill the whole thing out.
Yeah.
Okay.
And then you'll end up putting a barcode sticker over that thing, make a copy, it'll go with it. Because there's stuff you have to hand fill out, it can't be electronic.
Well, there's too many people that are messing with it, the patient, the nurse, the doctor.
Yeah, there's too many signatures required on it,
Yeah.
and we don't have electronic signature.
Okay. Under the ED transfer report is the registration tab. This is the tab where we will go to fully register our patient. When we launch into the registration tab, the screens we will see are going to be the identical screens that we see on the admissions side of things. I know we have not had formal admissions training yet, so for purposes of ER today, we're going to go through and input the required fields in order to actually process fully registering the patient. You can see there's about 8 different fields in there. The items that have the asterisk by them are the items that are required fields to be completed to register the patient. If you click the next tab at the bottom, as you work through those tabs, it's going to tell you if you have required information that is missing.
And there's no stars on a lot of these,
Yeah.
or they'll pre-populate from prior visits.
And that's how you go in to put a brand new
This
patient into?
No,
No,
you have to receive
you
them.
have to receive them
First.
and then go to registration on all patients.
Yep.
So right now, we're receiving them, we're registering them.
We're in the
Right
registration
now, we're
tab.
registering. we're in the registration. This is to complete the receipt part. And then you just keep clicking next until all of your stars are filled in. This was an emergent patient. No other stars, hit save. Patient's registered.
So for purposes of our training today, we're basically inputting the bare minimum. When admission meets with us to discuss the admission process, I'm sure they're going to request that we do try to get as much information as we can, as they do now with our registrations, so that we have that data on record for those patients. But they haven't technically required a ton of information in order to register patients from those fields. It's stuck.
No, it's going.
One thing to note with our ED system, it will not allow you to discharge a patient until they are fully registered. So if you get through the discharge routine, which we'll talk about here later this morning, and your discharge date and time is grayed out, that means you have not registered your patient more than likely. Not to mislead you and think that you cannot allow a patient to leave before they're fully registered. Yeah, we've had that question.
They could be here for hours.
They could be here for hours. You don't have to hold them up, but keep in mind, you don't want to let them go either until you've got registration information from them, So now you can see Patsy Test. Her registration status went from a received to a registered, or from a pre-ER to a reg-ER in the reg status column of our tracker. Okay. Under registration is the admit button. We're going to stay away from this button at this time. As we understand from admissions, we will actually be admitting the patients through the registration desktop, not through the ER desktop. So at this time, we will not be utilizing that admit button. And it has to do with assigning visits and billing, as we understand.
Because what happens is if you click admit and admit them as an inpatient or an observation patient, they do not get a new number. And because they do not get a new number, we cannot use this button. We will find out it's possible that maybe if they're going H&O, since they don't get new numbers now for an H&O, there's a possibility we can use that button for H&O only, but I don't know that for a fact. That'll all come through admissions once decisions have been made. But for right now, we will have to discharge the patient from the ER. They will get admitted as either an INO or an inpatient through the registration desktop to get admitted to the PCS side. So.
Under the admit tab is the sign up tab. This tab is utilized by the providers. It will not be a tab that we will need to go to. The way the sign up tab will work is once we notify the provider we have a patient, they can go in and physically sign up for the patient by clicking on the sign up tab, which basically means they're taking the accountability for the care of that patient. It's kind of, I don't know, kind of behind the scenes, but the physician will be the one that will access the sign up tab, so that's not a tab we need to worry about. The open and the close chart buttons, self-explanatory, same as PCS, where you can open and close your charts. The ready for discharge tab, that's basically just a visual. When you highlight your patient, if it's in black, it's going to mean that they've been fully registered, everything's been done with the patient, and they're ready to be discharged. Again, another feature intended for a large facility with multiple beds to allow different staff members to be aware when a patient is ready to be discharged. For us, we're going to know because we're the nurse and it's more of a one-on-one situation. If ever that ready for discharge is low lit, again, it's probably because they haven't been received or been registered. So they cannot be discharged until they are registered.
As you can see, this one's never been fully registered. You can't use that button. That's another hint that you have not completely registered your patient.
If you go back, we'll show you what you still need to do to get that one registered.
You go to the registration screen and complete the registration.
It'll show you what you need to complete on there.
Yeah, just like I had walked through, you have to fill in all the start columns, then click save and you're registered. It does not take long.
We have found, once in a while, you may see your registration tab is low lit. And that's because more than likely you put the patient in as an incoming. And you do not have an arrival date and time inputted. We ran into that the last few days with training. We've used an EMS patient. We changed the patient name, but we never went back in and actually inputted an arrival date and time. So the system doesn't recognize them as even being here, so it will not allow you to register them without them physically being here. So once you input an arrival date and time, which that actually is highlighted in red, when you go to the triage tab, you input the arrival date and time, and then your registration tab will be available to you to register the patient.
And that's under the triage tab on a patient. You have to put an arrival date and time here.
If it's an EMS, any incoming status, either an EMS or a call-in. For a walk-in, the arrival date and time will default in for you automatically. The management tab will not be a tab you will need to utilize. The indirect tab, same thing, won't be utilizing that button. And then the preferences tab, if you remember from PCS, at this time we don't want you messing with your preferences. This is where you could predefine how you want your data to be viewable on your particular system. We want everybody to look identical to start with, so that if we need to troubleshoot something, we'll find it easier to do that way. So at this time, we won't be accessing the preferences tab either. Any questions? Any of those body buttons? Let's take a 5-10 minute break, and then we'll get into the body buttons in the open chart.
Okay, remember to turn this back on, guys.
Oh, yes.